My name is Martha Larson, and I am with the Options Project, and I am pleased to welcome everyone to our webinar today, introducing PrepIt, which you will learn all about in the coming hour. Today we have presentations from Allison Cheng at USAID, Nicole Bellows and Catherine Kripke at Avenir Health, Cindy Motzi from the Eswatini Ministry of Health, and Joseph Marungu from the Pangaea Zimbabwe AIDS Trust. As I said, we do have quite a bit of material to cover in the next hour, and we will have time for question and answers at the end of the presentation. However, we do encourage you to use the chat function and not the Q&A function, because the chat function is visible to all participants, so it will foster a more robust discussion. The webinar is being recorded, and after the webinar, we will be sending around a link to the recording. And without further ado, I will go ahead and pass it over to Allison.
Great, thank you. Well, we're excited to be sharing the final PrepIt tool to all of you today. Launching and scaling of PrEP programming requires attention to a number of factors, both in terms of planning and then subsequent program monitoring. On the planning front, ministries of health and stakeholders need to consider the geographic areas and populations at highest risk that they hope to initially reach with PrEP, what impact that prioritization would have on their epidemic, and how best to program accordingly. Modeling different scenarios based on country-specific data can help with that priority setting process. Although I'll note, while that approach is recommended as a practice for prioritizing planning and initial scale-up, longer-term siloing of interventions by geographies or certain populations could have a negative effect on program success. But that said, once the prioritization process has been completed, ministries of health and stakeholders would then also need to consider how many PrEP users they want to target and initiate and maintain on PrEP. How many initial sites would that require? What are the staffing needs? What are the resource needs? And how much will it cost to deliver PrEP then? On the implementation side, programs then need to consider their site capacity needs and seek out program efficiencies whenever possible. As uptake and use over time progresses and demand increases, achievements need to in turn then inform future target setting and program planning. PrepIt is a tool that's designed to support these types of analyses and to be user-friendly based in Excel. It's also designed to be used at whatever level of information or data that a country has available, as you'll soon see. So even new programs can use minimal data and certain components of the tool most have used to them, whereas a more mature program could use more of their own data and more of the features. The concept and idea for PrepIt really originated with country stakeholders. It started when a couple of years ago, USAID with PEPFAR funding supported some modeling work on PrEP in a few countries conducted by the HP Plus project and Project SOAR. However, country stakeholders noted that in addition to modeling, what they really needed was a tool that could also incorporate site optimization in terms of staffing and resources, as well as that program monitoring and ability to do cost analysis. So we're fortunate to actually have some country representatives presenting their experiences on the webinar today with the design of PrepIt, and we're very pleased to be able to share with you the final tool. With that, I'm going to go ahead and hand it over to Catherine Kripke from Avenir Health to present an overview of PrepIt. Thank you.
Hi, everyone. Good morning, good afternoon, good evening, wherever you are. So I'm just going to present a brief overview of the tool. So PrepIt stands for PrEP Implementation, Planning, Monitoring, and Evaluation Tool. And it was funded by USAID through the Health Policy Plus Options and ETAP projects. It's an Excel-based decision-making and analysis tool, and it has 6 interrelated modules. That includes target setting, capacity and assessment, and efficiency analyses, tracking the cascade of PrEP service delivery, cost forecasting, estimating impact, and ARV forecasting. So we think of this tool as really having 2 different types of users. One is program planners, for example, people who are in the government or donors, and they're more going to be interested in things like setting targets, looking at the coverage, estimating the impact, and they'll also be interested in projecting costs and tracking progress of implementation. On the other hand, PrEP implementers will probably spend more time utilizing the functions that do things like assessing the capacity versus their needs, looking at efficiencies in service delivery, projecting client flow, and then, like the governments and donors, they'll also be projecting costs and tracking progress. So the important thing to know is that users can really focus on the aspects of the tool that are most suitable to their needs. I wanted to describe a little bit about the process for developing PrEP-It. So we started out with a literature review. We did country visits to Mozambique and Zimbabwe and met with all kinds of stakeholders in each of those countries to get information that informed the development of the tool. We also conducted consultations with global experts like WHO, UNAIDS, other donors, global implementers of PrEP. So we gathered quite a lot of information before developing the first draft of the tool. Once this draft was developed, we pilot tested it in Mozambique, Zimbabwe, Eswatini, and Kenya, and garnered further feedback from stakeholders in those countries about the usability of the tool, additional feature requests, and so on. The tool was revised, and now today we're very excited to be launching it. I wanted to mention a little bit about some trade-offs that we had to wrestle with as we were designing the tool, and some challenges. So one is that stakeholders requested a lot of different features, but then they also wanted the tool to be very easy to use. And we tried to address that by creating a tool that has as many of the features as we could incorporate, but also incorporating some navigation help to help people focus on those aspects of the tool that are most relevant to them. Can people please mute their lines if they're not speaking? Thanks. And then another thing that was requested was users wanted to be able to use the tool at any level. So for example, at the national level, at the district level, for a specific program, or even at the site level. So we did design the tool so that it could be used at any level. However, because it's in Microsoft Excel and because of limitations of Excel, the tool can really only be used at one level at a time. So there are a number of different inputs depending on which functions of the tool you're using. The first thing that anyone does is to select which functions they're using to help with the navigation through the tool. And then you're going to, depending on what you're doing, you're going to define the populations, look at your continuation rates, enter your program data, etc. I wanted to focus on a couple of aspects of the tool. So one of them is the continuation rates, and this is a critical component of the tool. It's essential for forecasting the future visits related to the target setting and service delivery. So the continuation rates mean the percentage of clients who are continuing to come back for visits at 1 month, 3 months, 6 months, or 12 months after initiation. And we require input of data for continuation rates for 4 points in time, and we call that a continuation curve. So there are different options for entering continuation curves into the tool. The rates may already be calculated from the country M&E systems. That would be ideal. If that isn't the case and the users need assistance with calculating the continuation rates based on their client records, there's a worksheet for calculating that within the tool. And then if you don't have any information about your continuation rates, but you still want to use the tool and you want to put something in there as a placeholder, we've provided some references from other implementation studies that have been published, and you can select those continuation rates that you think are the most similar or likely to be similar to your program. We also have the costing function, which was designed by our colleagues working on the ETAP project, who are economists and costing experts. And one of the things about PrEP-It is that it's costing based on the visit type, because the cost of the initiation visit is different from the cost of continuation visits. And so that enables the tool to account for different continuation rates that are that can be that are seen with different priority populations or different continuation rates that can be achieved by modifying the program. And you can see how that modifies your costs. So we have two different options for users to estimate their costs. For users that don't have a costing background or that don't have detailed cost data, there's a cost light, which is as simple as we were able to make it. And then for people who want to have a very detailed view on costing, there's a detailed costs worksheet that can be used. We have done as much as possible to provide default values for costs based on prior costing studies. And ideally, you'll have your own cost data, but if you don't, you can refer to these other costing studies, and we've translated as much as possible into country-specific costs. Now I'd like to talk a little bit about the target setting module. So there are 3 different ways that you can approach target setting. And I just want to mention that for PrEP, target setting is not a formula. It's really more of an art. It's going to be a discussion among the stakeholders. So you might use some combination of these. You might go back and forth between them. So one is, and the most popular is based on coverage of priority populations, which we think of as being kind of a top-down approach. Another one is a bottom-up approach, looking at the capacity for delivering services. If you think that your need is much greater than your capacity, then you might take this approach. And then the third approach is really you can just manually enter targets that you've already created, and that enables you to link the targets to other modules in the tool, to review the coverage, to assess your targets versus your capacity and other things. So this is kind of a busy slide. I'm not going to go through all of it. Nicole will be walking you through some of this when she demonstrates the tool, but there are outputs associated with individual modules, and then there are outputs that take information from multiple modules. So we're really excited to be launching PrEP-It today. The tool itself, the user guide, are available on PrepWatch. By the end of the day today, we should have some instructional videos posted, and I hope you'll go and check it out, play around with it, and let us know what you think. I'm going to pass it on to Nicole to walk us through the tool now. Thank you.